Hello, everyone. Welcome to our latest episode of Ask Dr. Dansinger with Dr. Michael Dansinger, world-renowned diabetes reversal expert with Diabetes Reversal Partners. He has practices in New Hampshire, Massachusetts, Virginia, Minnesota, as well as Florida. So if you have Medicare insurance or Medicare Advantage plans with a PPO, not HMO, PPO, make sure you do check out diabetesreversalpartners.com and check out his services because his diabetes reversal services are in fact covered by those insurance. So make sure to check them out. Today we are talking about diabetes and insulin resistance and your risk for blood clots with those. But then the easy ways in which you can actually mitigate your risk for blood clots, even if you do have diabetes, even if you do have insulin resistance. And we're going to talk about all that in just a moment. But first, I think it'd be really important, Dr. Danziger, if you wouldn't mind breaking down diabetes versus insulin resistance.
Great question, Kim. Thanks so much for the opportunity to have this conversation today. Another great topic, risk of blood clotting. But let's talk about insulin resistance versus type 2 diabetes. So, type 2 insulin resistance always comes before type 2 diabetes. So, if you have type 2 diabetes, that's usually after many years of insulin resistance. So obesity is the main cause of insulin resistance. It can also be genetic, so some thin people have insulin resistance, but insulin resistance is when the hormone insulin is not getting through into the cells and the organs and the tissues as efficiently as it should. For most people, the main reason is because they have some excess body fat in their abdomen, and that can affect the liver and the muscles so that the insulin cannot pass effectively out of the blood into the tissues. And so losing weight and healthier eating is the way to reverse the insulin resistance. Most people have a little bit of insulin resistance. Some people have a lot of insulin resistance. And so after many years of insulin resistance, the insulin producing cells of the pancreas, the beta cells, start to wear down. Let me use an analogy here. So let's talk about arthritis in your knee as an analogy for insulin resistance. It's a lot easier to imagine what arthritis in your knee looks like. And you might carry extra weight, which puts extra pressure on your knee. And that doesn't mean you're ready for a knee replacement. It just means you're at risk in the future for a knee replacement due to arthritis. And if you carry excess weight for a long time, you continue to cause wear and tear on your knee, and eventually you might get severe arthritis in your knee, leading to a knee replacement. And so in this analogy, insulin resistance is like carrying excess weight on your knee for a long time, and type 2 diabetes is the point where you have severe arthritis in your knee and maybe you need a knee replacement. So it's an oversimplification, but you can see how many years of carrying excess weight can put stress on all of your organs and your joints, and eventually you might get to the point where your pancreas wears out or your knee wears out. And so that's one way to think of how insulin resistance leads to type 2 diabetes.
Is it the same when it comes to young people? We're seeing more and more young people, people in their teens, actually getting diagnosed with type 2 diabetes.
Yes, those teens with type 2 diabetes have obesity, they have excess fat in their abdomen, and they've had that obesity for years before they get type 2 diabetes. And so, yes, it's tragic that what we're seeing as a nation is more and more teens with type 2 diabetes, but those teens have generally had obesity for several years before the type 2 diabetes happens.
And it's interesting when you use the term obesity. But then you're talking about excess belly fat as well. What I'm seeing, I mentor a lot of young women in my area, and I help them with their interview skills and inspire them to give back to the community through community service and help them with their community service initiatives. But one thing I notice a lot more with these young women is the excess belly fat. They might be fairly thin, they might be fairly athletic, but they have this excess belly fat. I don't recall young women having when I was a teen. Is that part of insulin resistance? Do we need to redefine obesity to include simply the excess belly fat around, well, the belly?
Yeah, Kim, you make some very good points. And so we've been using, the medical community has been using the body mass index to define obesity. And that's become more frowned upon in recent years. What I think, because if you have excess fat on your hips, that's not as dangerous as excess fat in your abdomen. And so really it's the belly fat that's fueling the insulin resistance. And so what I care most about is the waist to height ratio, which we've talked about briefly in the past. You want, whether you're a man or a woman, old or young, no matter who you are, an athlete or not, what you want is to know whether your waist size compares to your height. You want a healthy waist is half your height. And so the closer you are to that golden ratio of 50% of your height, the better you are. And if your waist is 60% of your height, that's too high, or 70% of your height, that's more dangerous. And so I wish that we would just switch over as a medical community to the waist to height ratio to really look at the risk of type 2 diabetes and insulin resistance.
And when we're talking about this excess belly fat that we have in the insulin resistance in particular, what are the actual causes? I mean, especially when we're talking about younger generations ending up with the onset early on. Is it the addition of the high fructose corn syrup into our diets? Um, the greater use of processed foods? I mean, I remember eating Chef Boyardee out of a can when I was a kid. I remember eating, lots of, some Haagen-Dazs bars and some gummy worms once in a while, maybe Milky Way Midnight. But every single, morning, I mean, my mom would always have the cereal for us with some berries, and lunch was always the sandwich on whole wheat bread. And much to my dismay, my little container, my thermos, clear up until eighth grade, my thermos of milk. And then
So,
dinner, we always had the vegetable, the starch, and the meat.
yes, so why have things been getting worse in the past decades? Let
Mhm.
me talk briefly about how it is that belly fat causes insulin resistance, and then we'll talk about why there's so much belly fat. So belly fat is continually leaking fat into the blood. And the abdominal fat leaks into the blood is the worst kind of fat. It's palmitate, which is a type of fatty acid. And the cells of the body um, are sensitive to that type of fat that's leaking into the blood from the abdomen. And so, nothing harms, you know, cells of the pancreas more than the combination of palmitate and glucose. So that's like a bullet and a gun together. They, having the combination is especially lethal. So insulin resistance is caused by free fatty acids floating around in the blood, and that comes from diet, and it also comes from belly fat. So why is there so much belly fat? So, women have been premenopausal women, right? Women under 50, let's say, have been largely protected from belly fat because they have estrogen that helps make sure that excess fat is on their hips and not in their bellies so much. And then with the loss of estrogen after menopause, we see a redistribution of fat toward the belly. Also, in children, right before girls before they reach puberty carry their excess fat in their abdomen, but then later, once they have active ovaries that with estrogen, then they redistribute the fat toward their hips. Um, so the reason there's so much but just because you have fat on your hips does not mean that there's none in your belly. It's in there hiding. It's just not, it's not as prominent as it is with men. So we're very concerned about your waist to height ratio. And it's all the calories in the American diet. People are going to restaurants more than ever rather than making food at home for all sorts of reasons. Many of us are just too busy to put in the time and the effort to make home cooked meals. Or 50 years ago, it was pretty normal for the mom to stay home and fix a nutritious meal, and times have changed. And so people are more on their own for their meals, and it's natural to go for restaurant food more often. And the restaurant food just gets more and more enticing than ever. There's more and more ethnicities and options out there. They'll deliver it to your house, so much more easily than ever before. If you look at the foods in the grocery store, many of them weren't there 10 years ago or 20 years ago as the food industry has gotten more and more sophisticated at giving us high calorie convenience foods. And so the food supply has just become more and more exaggerated from what humans are really supposed to eat. And so, next month, I promise you, there will be new flavors of chips and cookies and that sort of thing. And so that's the number one reason. Many people are increasingly concerned about toxins in the food. Let me give you an example. If you almost everyone is eating food that's coming from has plastic in a plastic bottle, plastic container, plastic wrap. There's plastic is, used for packaging food. And we've been learning in recent years that the plasticizers, the chemicals used to make plastic, have mild endocrine effects that might be causing more and more women to have fat in their belly, maybe even larger breasts, and have interfered with sperm production. And so there's endocrine disrupting chemicals in the plastic. And many people, I think that these are mild but cumulative effects over the course of many years. But there's a lot of foods unknowns in the food supply. And so the best way to protect yourself from all of these unknown chemicals in the food supply is to eat clean. Eat vegetables and fruits and unprocessed foods and wild, meats, and not highly processed foods. So these chemicals are one of the contributors that might be changing the way we have, distribute fat in our bodies.
And so once you do have insulin resistance, is there a way to test for insulin resistance, or should we? I know we have our basic panels, blood panels that we get during our annual exams, even when we're younger. Is there a way that insulin resistance pops up in those blood markers?
Insulin resistance is easy to measure with a simple blood test, but most mainstream doctors are not doing it. And it's much to the shame of the medical community, in my opinion, that they're overlooking this important way to measure it. To measure insulin resistance in your body, you need to measure the insulin level in the blood and the blood sugar, the glucose, at the same time in the same tube of blood. And if you measure those two at the same time, you can calculate a score for insulin resistance that's called the HOMA. You can also calculate your beta cell function with the same pair of blood tests. And so the HOMA B is the measure of beta cell function. You want your beta cell function to be around 100%, and you want your insulin resistance to be as close to normal or 1 as possible. 1.5 or less would be good. And so, yes, doctors should be measuring insulin and glucose and giving people a score for their insulin resistance. No question about it.
And they should know what it is. So it's if you said to your doctor, hey, I want you to measure my insulin resistance in every annual physical exam, and with blood work, they should know exactly what to look for.
Yes, they can. Any doctor can measure your insulin and your glucose, and you tell them why. But that same doctor might say, well, I know a lot about your insulin resistance because of your waist to height ratio. So the waist to height ratio is a really good predictor of what your insulin resistance would be like. It's not as accurate as measuring it in the blood, though.
So, how exactly does insulin resistance increase someone's risk for developing blood clots?
Yes. So let's talk about blood clots and how it relates to insulin resistance. And so, what we're worried about, I'm going to call it, you want normal blood clotting. And really, we don't talk about this as much, but it's crucially important in people with PAD, peripheral artery disease, because you're trying to get blood, into your feet and the rest of your limbs and all over your body. And if your arteries are narrowed, you can't afford to have blood that's, too thick. And so blood clotting becomes abnormal if your blood is too thick, or if you have too many clotting factors, or if the lining of your arteries is all inflamed or sticky. And so insulin resistance means that the liver also has insulin resistance. And when the liver has insulin resistance, it makes more clotting factors. And if you have too much or abnormal clotting factors, that means the blood clots too easily, and you can get not just large blood clots like in your legs that could go to your lungs, but you get microscopic blood clots that can clog up the small arteries in your heart or in the brain. And so if your blood is too thick, that increases the chances of heart attack or stroke or damage anywhere that the blood flows. So there's different forms of, abnormal clotting, and they're all related. They all improve or worsen according to healthy habits. So the good news is we don't have to, a person who's trying to protect themselves against thickened blood can just follow the healthy eating strategy that they would use for any healthy outcome, and that will help improve the clotting risk of their blood. And so I'll give you an example. We've already talked about how wild fish, like salmon, for example, is healthy because it has omega-3 fatty acids and DHA and EPA in particular, and these thin the blood, and that's what we want. So fish helps directly to thin the blood. Any fish is good, but especially wild fish. Anytime you're eating fish and shellfish, as long as it's not battered and deep fried, it's going to take you in the right direction. And other healthy fats like olives, so olive oil or olives, avocados, or nuts, all those have omega-3s and monounsaturated fats, and they're going to help to keep the blood clotting normal. And fruits and vegetables all help decrease inflammation. Inflammation causes abnormalities that thicken the blood and increase the clotting risk, but all the compounds that make fruits and vegetables colorful are favorable for artery health and for blood clotting. And you can imagine the opposite is true for all the unhealthy food. All the obviously unhealthy foods have mechanisms that thicken the blood.
So how quickly can these, we all want overnight
Yes.
results, right? So, how quickly can lifestyle modifications improve circulation and reduce clotting risk?
So right away, so you can see improvements in these blood markers within, 1, 2, or 3 months. So you can see improvements in your insulin levels and in your glucose literally overnight. But you can you can see improvements in blood clotting factors like fibrinogen or CRP or other markers of inflammation very quickly within a month or so after consistently following a healthy eating plan, after switching away from an unhealthy eating plan. You can see the hemoglobin A1C improve, within 3 months. And so if you can eat consistently healthily for a week, you can start to see it in the blood. But
And
results are cumulative, of course, right? So if you just eat healthily for a week and then go back to old ways, in the end, that's not going to do nearly as much as if you're consistent for 3 months. You can dramatically reverse these blood clotting abnormalities.
now, what about supplements? Because we have been seeing an influx in these big vats of supplement powders that
Yeah.
claim to clean the arteries.
Okay, so great question. That's really important, and supplements are often on our minds. Let me start by saying what I've said before. The power of food is 10 times more important than the power of supplements when it comes to trying to fix the types of things we're fixing, right? If we're trying to protect ourselves against worsening PAD, then food and exercise is, 10 times more important than supplements. Having said that, let's talk about some good candidate supplements. I'll start with fish oil. So fish is better than fish oil, but fish oil is better than nothing. So we talked about how fish oil can help thin the blood. And so I think I check with your doctor, right? All of our advice about supplements, you know, means you you get your healthcare team involved. All right, but omega-3 supplements, fish oil are good. Magnesium, um, is is one, and
Is it
another.
magnesium glycinate? The one, and
Yeah,
that's especially, it's also helpful for evenings to help you get a better night's sleep.
I want you to, yes. So magnesium glycinate is increasingly popular form, but of course I want you to get your magnesium from you know from greens. That's the best. But also, if you take a magnesium supplement, that is more likely to, that could help. Another supplement I like is berberine, helps with insulin resistance. So I think that one has the most evidence for it, when it comes to measurable improvements in insulin resistance. And so weight loss is better, but berberine is available probably in most Walgreens or CVS, and you can follow the package directions on that. And so, um,
What
a
about nitric oxide?
nitric
That was one of
oxide.
them.
Okay,
That was one of
so
the ones. It's a big vat, and it says it gives you 3 times the nitric oxide that you get in food. So this is what's going to clean your arteries and make you healthy again.
okay, yeah, I'm glad you raised that. So um, our bodies make nitric oxide, which is actually a gas, but in very tiny, the molecule of nitric oxide helps with um, relaxing blood vessels and repairing blood vessels. And so the lining of our arteries is called the endothelium, and the cells of the endothelium thrive on nitric oxide. And so you want to get it from a healthy diet, but if you take a supplement, that might help boost nitric oxide. And so you can't take nitric oxide directly because it's a gas, but you can take compounds that turn into nitric oxide. And so L-arginine and citrulline are examples of supplements that turn into nitric oxide. And there are some studies that show that compared to placebo, these nitric oxide enhancing supplements can help with PAD outcomes like walking distance and um, brachial endothelial reactivity on ultrasound. And so, yes, those are some supplements. Do you have any, Kim, additional ones that are on your mind?
Well, the nitric oxide, I always want to make sure that there are contraindications. So that is something that people should really, with any supplement, discuss with their doctor first
Yeah.
to make sure that it does not interfere with any of the medications that you're on or any of the other comorbidities such as congenital heart disease and heart failure and things like that. And you always want to make sure that you're always checking in with a nutritionist or a doctor of nutrition or a dietitian or the like to make sure and monitor your usage of those, because a lot of these supplements, like even vitamin D or magnesium, they can always be measured in your body through blood markers. And so you should have regular testing at every 6 months to a year to make sure you're not overdoing it.
Yes. So another supplement that I am aware of is beet powder.
Oh, I love beet powder. Beet powder, I heard, is actually even contraindicated for people on blood pressure medications because it works so well to reduce high blood pressure in high amounts.
So beet powder is out there and it can have favorable effects on blood vessels. You know, it's an antioxidant. And again, it's something that you can check with your healthcare team about, but that might have a role. Again, you know, I'm a big beet lover. They just taste great to me. And that's the best way to get your beets. But beet powder is available as well. I have mixed feelings about the juices, right? So there's like beet juice. There's a lot of sugar in beet
A lot of
juice.
sugar.
You know, all of
Yeah.
these vegetables have a juice form. I think it's just better to eat them rather than to juice them. And then there's all the herbs and spices, and so you know they have anti-inflammatory effects. So ginger, turmeric, garlic, Ceylon cinnamon are some good examples, and then most of the dried herbs all have beneficial effects. But again, these are subtle compared to what you could do with, you know, make a healthy stir fry and add those in, for example.
Ever since you started talking about cayenne pepper, I've been adding it to everything. I don't add too much because I can't tolerate too much heat, but I try and I figure that if I add it on everything, at least in 2 meals a day, I add it to whatever I'm doing for lunch, even sprinkle it on my salad or whatever I'm doing for dinner, just adding a little bit. I figure that it probably builds up. And I always get the organic cayenne pepper just to double check and make sure, because you had also mentioned before that you do get a higher quantity of the spice or the herb when you're doing it in some sort of powder form than when you're actually doing it, even with, if I'm doing garlic, for example, and I'm chopping up garlic, you actually get more benefits from the garlic if it's in the powder because you're consuming more of it, is what you had said once.
Yeah, so I'm having trouble recalling in part specific about that. I think it's going to depend, but I'm going to backpedal a little bit on that, Kim, and say first choice is always to get it from the food. You know,
Okay.
I might have given an example of spinach. You know how, you know, the benefits of spinach, you know, there's you know how spinach cooks down a lot and you can have, you know, you can cook, you know, 10 cups of spinach down into 1 cup of cooked spinach. And I think what you're talking about is, you know, in the powdered form, let's say beets, for example, you can get a lot of beets into powder form, but I'm still going to recommend eating jalapenos and other peppers over the powdered form. as a general concept.
Okay, so
They
we're
both
just
have a
gonna
place.
bring it. Hey, it's selective. So I do understand. So when it comes to the beets or
Uh-huh.
the spinach, I definitely see. I hear you on that, and I do even prefer fresh garlic as well, or the jalapenos or whatever. But also maybe adding a little extra in the powdered form might be helpful as well. But thank you so much, Dr. Dansinger. Always a wealth of information. I really appreciate it. If you like this video, make sure you do take the time to like the video. Also, subscribe to our channels, and we have great new content every single week. Thank you again, Dr. Dansinger, and thank you, everyone, for joining us. We really appreciate you.
Thank you, Kim.